Hi, my name is AZMI, and today I will present about the introductions of the third SDG goals, which is good health and well-being. Sustainable development can be defined as constructing a social and economic system to sustain a specific goal, such as increasing in educational standards, quality life, health of nations, and real incomes. Basically, the establishment of sustainable development is to protect a social welfare and right, which involves in every aspect that has been stated before. There are 70 goals of SDG that needed to be achieved by end of 2030, but today we will only focus on the third goal of SDGs, which is good health and well-being. Thus, to achieve the third objective, setting is the important key to emphasize the keys and target of the SDGs 3. Hence, there are three key aspects in SDG 3s that need to be achieved, such as health, where it focuses on achieving a healthy mentally and physically society and providing a higher standard of health to the peoples without being biased or racist. The second is well-being, where it emphasizes on factors such as satisfaction of material, physical, affective, and psychology that focus on both aspects, physical and mental. And the third one is for at all age, where it emphasizes health from a temporal and social perspective. The protection of health was already at the heart of the development agenda under the Millennium Development Goals (MDGs), with several goals concerned with health, including MDG 4, reduce child mortality, MDG 5, improve mental health, and MDG 6, combat HIV, AIDS, malaria, and other special diseases. Therefore, to achieve all of these objectives, there are tons of effort that needed to be applied in order to ensure all of the people in around the world is in a good state of health. Hence, with emphasizing a good funding and a health system could ensure the system are running with more effective and efficient in all aspects that could save a million lives of people that are needed to be saved. That's all from me.
Hi, my name is JASMINE binti SHAHZAN, and today I would like to present about the National COVID-19 Program. The Ministry of Health Malaysia (MOH) is the government ministry in Malaysia that is in charge of the country's overall healthcare system. It has been more than a year since the outbreak of the COVID-19 infection, and despite the fact that numerous preventative and control measures have been put into place, such as the practice of wearing face masks and keeping a safe distance from one another, the infection has not been stopped from spreading. As a direct consequence of this, the National COVID-19 Immunization Program (NCIP) is one of the most extensive and up-to-date initiatives run by the Ministry of Health Malaysia. The purpose of the National Immunization Programs is to vaccinate between 70 and 80% of the population by February 2022. This will help prevent the further spread of the COVID-19 virus. In addition to public health facilities, private health centers are also involved as possible vaccine center. As of the end of May, the government had received registrations from over 2,500 private clinics and 116 private hospitals interested in becoming potential vaccine center. The COVID-19 vaccine will be used in 3 stages, that is Phase 1, Phase 2 and Phase 3, and the types of vaccines provided by the Malaysian government are: the first one is Pfizer, and the second one is AstraZeneca, and the third one is CoronaVac Sinovac Biotech.
Assalamualaikum, my name is AFIQAH binti JAMALUDIN. So as mentioned in the previous slide, the National Immunization Program has included all Malaysians aged 18 years old and up who are eligible to receive the COVID-19 vaccine for free during the pandemic period. Vaccine will be given in curtain area that provided as vaccination center. So how do citizens want to get the vaccination? So first, the Ministry has provided many ways for citizens to register or book the appointment, which are by MySejahtera application, hotline, website, and also registration at public health facilities. So it has a variety of ways to book appointment, but mostly around 3.7 million Malaysian citizens choose to use MySejahtera application. Besides that, the party that involved for this program is the Ministry of Health, Public and Private Health, doctor and nurse, and also the important department is the Special Committee to grant the access to the supply of vaccine COVID-19, that is JKJAV. So the objective of the establishment of JKJAV is to ensure that the supply of the COVID-19 vaccine is obtained immediately to implement the immunization program is carried out. Apart from that, it can be said that almost 90% of all activities and objectives has been achieved. This is because we can see that now the economy is starting to improve. All industrial sector have reopened as usual. In relation to that, according to the analysis, 86% of Malaysian citizens have received the first dose vaccination and 84% of Malaysian citizens have received the second dose vaccination. The involvement of Malaysia is very encouraging that bring economic, social and environmental recovery of the
Assalamualaikum
country.
warahmatullahi wabarakatuh. My name is Syuhada binti Amran. We'll present about the National COVID-19 Immunization Program. Right, this National COVID-19 Immunization Program provide benefits to local people, our society, the economy and the environment. In terms of local people, the benefit received is building the body's natural defense against disease attacks before a person start to get sick. And then the body will detect these viruses and produce antibodies aimed at fighting the presence of the virus. This program meets the current needs of a Malaysian, which is to have healthy health that can carry out daily life safely. Besides that, it is economy. The benefits that will be received through this program can help in restoring the national economy. As we know that Malaysia already ran a movement control order, but now when this program exists, it brings the economy to run as usual. From this point, people can work as usual and the purchasing power will increase, and indirectly the economy will increase from time to time. Last but not least, environment. When Malaysia was hit by the COVID-19 pandemic, the government issued to all citizens to always keep a distance from each other no matter where they are. The virus can be spread in a situation such as where a person interacts face to face at a close distance. A citizen will be more careful in taking care of their health, including personal hygiene, the environment, so that the body's immunization is stronger.
Hi and Assalamualaikum. My name is NADIA binti SHAMSUL KAMAL. My matric number is 2020881348. I am from AM 1105D. I will continue by explaining how to solve the program's shortcomings and challenges. The first suggestion to improve this program is create advertisement. For the information, advertising is a method of communication with the purpose mentioning information in activities. This is done through promoted media. For example, advertisement can be made using posters, display on television screen, on websites and also in applications such as TikTok, Instagram and many more. With this, information of international vaccination programs is likely to be disseminated more widely. The next suggestion to improve the vaccination program is increase the number of staff or volunteers. The reason is to overcome the crowding of people who want to get vaccinated. For example, the number of doctors, pharmacists, nurses, volunteers bodies parallel in the increase in the number of people who will receive the COVID-19 vaccine. Not only that, but the small number of staff could also not control the vaccination program well. Therefore, increasing the number of staff during the vaccination program is a good way to improve the challenge of the programs. To wrap up, the National COVID-19 Immunization Program conducted by the Ministry of Health, which was held from February to April 2021, gives a positive impact on the people and even on the country. The proof is that the community can receive the vaccine at a critical times when the transmission of the coronavirus is very high. Not only that, but this program has also been well received by the entire community in the country after all the hard work given. This vaccination program aims to protect the community from COVID-19 infection, and most importantly, it can enable the country's economy to operate normally again without obstacles. Although there are some shortcomings and the weaknesses of this program, but however, every shortcoming can be resolved well. Even so, the impact of the shortcomings faced when organizing this program can further improve the stability of the program and for the future. With this, it hopes that the Ministry of Health will consider every deficiency that occurs. So, that's all the presentation from our side. We hope this study can give you new knowledge. That's all. Thank you.